How does a radiologist interpret arthritis imaging scans? Imagine looking at a picture of a joint and being able to tell exactly what kind of arthritis is affecting it. That's what radiologists do when they interpret arthritis imaging scans. They use special tools like X-ray, magnetic resonance imaging, computed tomography scans, and ultrasound to see inside the joints. Each of these tools shows different details, helping doctors understand what's happening beneath the surface. X-ray images are usually the first step because they are quick and easy to get. Radiologists look for signs like joint space narrowing, which shows cartilage loss, and bone spurs called osteophytes. These are common in osteoarthritis. They also check for bone erosions and joint destruction, which are signs of rheumatoid arthritis. The images help determine how much damage has occurred and what type of arthritis it might be. Magnetic resonance imaging, or MRI, gives a much clearer picture of soft tissues like cartilage, tendons, and the lining of the joint called the synovial membrane. It can spot early cartilage damage, inflammation, and bone marrow edema, which is fluid buildup inside the bone. MRI is especially helpful when symptoms suggest arthritis but X-rays don't show much yet. It can reveal changes before they become obvious on X-ray images. Computed tomography scans, or CORT scans, provide detailed images of bones and complex joint structures. They are useful for visualizing bone spurs and planning surgeries. Ultrasound is another helpful tool. It can detect fluid buildup, inflammation in tendons and ligaments, and guide procedures like joint injections. Ultrasound is also good for checking soft tissue swelling and inflammation. When radiologists review these images, they follow a step-by-step approach. First, they decide if the changes look degenerative, like in osteoarthritis, or inflammatory, like in rheumatoid arthritis. Degenerative changes often show uneven joint space narrowing and osteophytes. Inflammatory signs include bone erosions, soft tissue swelling, and symmetric joint involvement. They also look for early signs such as bone marrow edema or synovial thickening, especially on MRI. If the findings are unusual, like arthritis in a young person or in an uncommon joint, radiologists consider other causes. These might include infections, crystal deposits, or trauma. They pay close attention to specific features. For osteoarthritis, they focus on cartilage loss, bone spurs, and changes in the bone underneath the cartilage. MRI can detect early cartilage wear and bone marrow edema that X-ray might miss. For rheumatoid arthritis, early signs include soft tissue swelling and reduced bone density. As the disease progresses, bone erosions and joint destruction become visible. MRI can show inflammation of the synovial membrane, cartilage thinning, and bone marrow edema before damage appears on X-ray. Ultrasound helps evaluate soft tissue inflammation and guides treatment procedures, while CORT scans are used in complex cases or for surgical planning. Imaging plays a vital role in confirming the diagnosis, assessing how severe the arthritis is, and tracking how it changes over time. Detecting early signs allows for earlier treatment, which can slow joint damage. Regular imaging helps doctors see if treatments are working and decide if surgery might be needed. Radiologists work closely with rheumatologists and other specialists to match imaging findings with symptoms and lab results, giving a complete picture of the patient's condition. In summary, radiologists interpret arthritis images by recognizing patterns of joint damage, distinguishing between different types of arthritis, and using advanced imaging techniques to find early or subtle changes. Their detailed reports help guide diagnosis, treatment, and ongoing management, helping patients maintain better joint health.